Hi, my name's Sam. I'm the dental hygienist and therapist at MyHealthcare clinic at Battersea Reach. Quite a lot of my patients ask me about toothbrushing, how you should use your toothbrush and what toothbrush to use. So I'm going to talk a little bit about how to use your toothbrush, what toothbrush to choose and how to use them. You have a choice of either a manual toothbrush or an electric toothbrush. With a manual toothbrush, you should always look for a toothbrush that has a nice small head and all the bristles flat and the same length with a medium texture. You should also look for a handle that's nice and easy for you to hold. When you're using a toothbrush, you should position the brush at a 45-degree angle towards the gum margin. So you should have your toothbrush just like this. And then if you move your brush in small circles and work your way around your mouth. Toothbrush manufacturers recommend dividing your mouth into 30-second sections. Because we are of a dominant hand, it's really easy to miss some areas without even realising. So dividing your mouth into 30-second sections can really help. So if you divide this corner into 30 seconds, this into 30 seconds, and then the same for your top teeth, and that way you're less likely to miss any areas of bacteria around your mouth. So if we start from the back of the mouth and work in small circles, from the back until we get to the middle, and then if we go over the top to the inside of the teeth, working in small circles until we get right to the back, and then a little bit of a sweep over the biting surface. Now sometimes moving in small circles can be quite difficult, particularly on the inside of the mouth. So what we can also do is positioning the brush at 45 degrees and then sweeping upwards to dislodge any little bits of bacteria that we have. Alternatively, it's possible to use an electric toothbrush. Now there are two different kinds of electric toothbrushes on the market. You have the small round head oscillation rotation, and we also have the sonic style, which is more of a traditional toothbrush style head. With the round head, the bristles move from backwards and forwards. That will help create a sweeping motion to remove the bacteria from the tooth surface. With the sonic style brushes, the bristles have a waving motion. That encourages the water from when you dipped your toothbrush underneath the tap to mix with your toothpaste and saliva and create a water movement that will help flush the bacteria from the tooth surface in combination with the sweeping movement of the bristles. With any electric toothbrush, it's important to remember to let the brush do the work for you rather than actually mechanically brushing with the toothbrush. So if you keep the toothbrush nice and still when you're using it so that you're not missing any areas. With the round head brush, the head of the brush will actually fit over the tooth. So you want to position your brush again with your 45-degree angle, same as what you would have with your manual, so that the head of the toothbrush is covering the portion of the tooth. What you then want to do is switch the toothbrush on and then leave it nice and still for 2 to 3 seconds so that the toothbrush has the time to remove the bacteria from the surface of the tooth. And then if we move on to the next tooth, and do the same thing, working your way forwards. Once you reach the middle of your mouth, if you then go over the top of the teeth and then work your way back along the insides, covering the inside surfaces of the teeth, right the way to the very back of the mouth. Once you reach the back of the mouth, if you then do a sweep over the biting surface so that everywhere around the tooth is covered. Again, it's a good idea to divide your mouth into sections so that no air is missed. 30 seconds for each corner of your mouth gives you a nice even 2-minute clean in total. With the sonic style of brush, again you want the same 45-degree angle positioning of the toothbrush, and the toothbrush should tuck quite neatly against the side of the tooth. Again, with the toothbrush, very slowly slide it forwards, but let the toothbrush do the work for you. Start from the back and work your way to the middle. When you reach the middle of your mouth, if you go over the top, and then work your way back along the inside of your mouth until you reach the very back, and then do a sweep over the biting surface so that any bits of bacteria that are sitting on the biting surface of the tooth you'll remove. It's important to remember with any toothbrush that you spend 2 minutes brushing your teeth. That way you're less likely to be missing any areas of your mouth.